Awesome. Cool. Well, then, if you've got questions, you can just pop them into the chat, and just know, I know that people will be popping in and out during the hour. But I'm going to go ahead and get started with discussing how just some of the top 5 ways that synthesis transforms your clinical work. So the first thing that I think is really different about this framework, which is evidence informed, is really doing a deep dive on the self of the clinician. When you look at the literature, I think it is fair to say that half of client outcome, and this is looking at common factors as well as just the research on highly effective clinicians, that outcomes are largely dependent on who we are as a human being and how we show up in the room, in the relationship as a human, and how we relate to our clients as human beings. And what's really, when you really look at the literature and what it is saying, it is pretty stunning how huge this is. And then when you look at how we train both people in grad school, how we award licensures in most states and countries, and even what is emphasized in, post-licensure training, there is almost no self of the clinician work. In fact, I offer CEUs and I have to read real carefully as to how much self of the clinician work is allowed in a CEU. It's kind of crazy. And I think we got some folks around the world, CEUs is continuing education units here in the United States. So, and I think other countries sometimes use that language too, but it's almost heartbreaking how our field has really not developed better ways to develop just the self of the clinician. The reason it's heartbreaking is because I talk to so many mental health professionals, and it is heartbreaking how much personal suffering is for them as they are doing this work. So a big piece of this course is to look at who you are as a human being, and to bring, it is continuing education, to bring to bear all the knowledge of the field to help develop, clinicians as human beings. And so, and the research does show that it is 15 to 20% of clinicians are just consistently get better outcomes regardless of client severity, client type. And even when they give them different theoretical models to use, they watch them using these treatment plan these manualized models, and they use different ones, and they still get better outcomes than the vast majority of other clinicians. So there is also a group of 15 to 20% that are consistently worse. So this self of the clinician piece is really huge. And what it looked, and the way I am thinking I do this work or train in this way is to have you really look at all six areas of being human that include, spirituality, your emotional life, relationships. We look at your physical health. And there is now so much literature about how physical health affects mental health, which is another real important component of doing this work well, I think, and is part of a really comprehensive overarching framework. But we start by looking at you and your health. And then we also look at your financial well-being, and that's a really weird one. And it's one I actually have a lot of anxiety about even talking about, just because but there is something called financial therapy, and over half of people who come in for mental health reasons are having financial struggles. And so I think it is so important as mental health professionals to actually have a grasp on how our own finances work, how living kind of, we talk about living a balanced, life in terms of our mental health, our physical health, but there's also that financial balance and understanding how that works. Because I can tell you, because I've seen it in training new clinicians, if you don't understand, the basics of how finances work, you really have a hard time helping like couples who often fight about finances, because you're going to give, you're not going to know exactly what's going on there. This actually comes up a lot more than you realize. So having a basic understanding of that as well as another area that we look at is your professional career development path, having a clear path that you're on, feeling good about that. And then finally looking at, do you have fun and adventure and a quality of life that you really love? So we look at all those 6 areas because your clients have all these 6 areas too. But and the idea is you'll never be perfect. Not all 6 areas are going to be functioning, optimally at all times in your life. That's not realistic. But really developing a plan for becoming effective in all these areas. And the one piece that I just love, and I had so many people who took this program before, what they loved about it was, I call it becoming effective at everything, but you learn how to set very small goal. You don't take your big goal, we break it down into a tiny little goal. You actually get a whole plan for lifelong kind of developing self of the clinician, who you are, creating the life that you love. We actually do that using, a lot of the motivational psychology that for some reason in mental health, we don't use near enough of. So, and I had a lot of people, this was the most powerful part of the whole program in terms of just, I think, improving their own mental health, in terms of increasing their sense of reducing that sense of imposter syndrome. But I just think as a field, we're going to have to get a lot better at, and a lot more direct and spend more time doing this, so that we are doing such hard work in the 21st century. Oh my God, just the trauma that people have been experiencing over, we have the pandemic, we have climate change, and just numerous natural disasters that, have affected hundreds of thousands of people, at least here in the United States and around the world. I mean, I'm losing track of the volcanoes that are erupting. On top of that, many countries are experiencing severe political divides or divides around race and similar issues. And so that's a lot. And I don't even think we've begun to see the fallout of everything that has happened in the last couple of years in terms, and we'll be picking up the pieces as mental health professionals. And to do that well, we really need to know how to take care of ourselves and get ourselves in a really solid, good place, because it is clearly the number one thing that affects outcomes. And so even though my model is all about synthesis, one part of that synthesis is just using all the research we have. And it is so clear that we need to become very effective humans in our own life so we can help our clients do the same. So that is the number one thing that you get out, I think, of learning to work with synthesis. The other is learning how to connect well. And again, it's sad to me in some ways that our field has some pretty archaic ways of teaching how to do this. And almost all programs I know start with using a humanistic base, which is great because you're focusing on the subjective reality. But the piece that we don't do enough with is looking at the intersubjective reality. And often, most of the time I hear people talk about humanism like it's so different than postmodernism. But the truth is postmodernism is humanism 2.0, because it is one subjective, subjective reality, the clients, but there's also the clinician's subjective reality. And our task as mental health providers is to communicate across these two subjective realities in a skillful way. And so that is such an important piece of all of this. And the most incredible thing to me is that there is now neurobiology that describes how this works. They can measure how brains literally get into what they call neural resonance, and clients feel felt. And that 15 to 20% of clinicians know how to do this, and you do it within minutes of a session. And clients can feel it even over the telephone. When I talk to people on the phone, they often say to me, like someone's calling asking for, to meet with me and do some clinical work. I often hear people say, in talking to you in 5 minutes, I feel more connected to you than I ever did to that therapist I just worked with the last year or two. And that is because this ability to get a neural resonance is so powerful. And it also is what allows them to quickly work through trauma and difficult emotions, because they literally borrow our neural resonance, which gets back to point one. We need to get our act together. And we actually, our state of mind that is measurable, like what are the brain waves? Are we in neural, are we in an integrated neural state? That matters, and clients feel it, and it transforms how quickly they are able to actually resolve the issues they've come to see us with. And so this is something that we have the information, but it is not well taught. And again, all of the research is really, really behind this. And I think the most powerful part of this is that when when you're better able to learn how to connect across these two subjectivities, you are much better able to work across cultures, across subcultures, to deal with the unique realities that everyone has based on their unique social location, no matter how much they look like you, no matter if they go to the same religious, ceremonies that you do, that everyone still has their unique subjective way of interpreting all of that. And I think folks get a little bit messed up here, because there is a difference between how you transform society around, social injustices at a societal level versus on a one-to-one human level, and how you transform across those divides. And so, and this ability to connect well, and it is so, so powerful. And it's drawing upon what we have in humanism, postmodern, social constructionism, where you're doing across the intersubjective reality. And then the real, I think, magic, or what I call the secret sauce, is making sure that you're able to get into that, what they call an integrated neural state, and you're able to connect in such a way that that there's actually neural resonance between the two brains, or two or more brains. It is incredibly powerful. So 3, I think this is where I think synthesis is the most obvious, in that it is actually possible to boil down all of our major theoretical models into a single comprehensive case conceptualization framework that is so simple and so much easier. The vast majority of people practicing today don't actually use case conceptualization in a lot of depth, because it's too complex for the person who's actually in the room. And so, all I can tell you is, like 30 years ago, we were able to much more easily take time to sit back and reflect and use really complex theoretical ideas to case conceptualize our clients. Because, a full-time practicing clinician back in the day rarely had more than 20 clients. And that, so if you're doing a 40-hour work week, and they didn't have nearly the paperwork that they had got crammed, that is just so bureaucratic and behavioral. And because, at least in the United States, you can't put a lot of sensitive information, it's very medical, what you're writing down discourages case conceptualization. It's kind of a mess, really, because it's the case conceptualization is where the magic happens. This is what makes you different than a bartender or hairdresser or good friend who gives good advice. You're able to take the problem that the person's talking about, put it through this new framework that allows you to understand it in a totally new way, and to really identify where, when, and how to make change. And so in my framework, I boil it down to 4 basic levels. And we really look at the symptom cycle. We look at, when the symptom is mild or not there, how it escalates, when it gets to its peak or its worst, and then how you get back to normal. And so we track it, this whole life cycle, so to speak, of the symptom. And we do it behaviorally. And we really look for the complementary patterns, because if you actually analyze all the theories out there, there are so many theories that seem so different, but they all do this, what are the opposites at play in this pattern? So the next level on top of that is the emotions, looking at both primary and secondary emotions, that shift. How do the emotions move across this cycle? which is very eye-opening for most folks. And the next level is really where most clinicians actually like to spend a lot of time in terms of the cognitive level. And most theories are cognitive. They wouldn't call that, only the CBT people call it cognitive, but most interventions in mental health work at this cognitive level. I'd say 80% of them at least, because you're shifting how a person thinks, what their beliefs are. You can call it irrational thoughts, you can call it cognition, you can call it schemas, you can call it, beliefs, or some of them call it stories, whatever. I mean, it goes on and on. Social constructions or cognitive, okay? Any social construction is a cognitive thing. But, along with that, those cognitions create our identity narratives. And that is, I think, the most powerful piece, especially when we get into stabilizing change. But looking at how even your identity shifts in the various phases of the symptom cycle. So this is where most of us gravitate to. Honestly, it's where I usually have the most fun. Especially at that identity level, is just fascinating when people begin to see how their identity shifts around all of their symptoms or problem interactions. It is transformative just to even recognize it. And finally, the last level is societal. And there is so much discussion in our field around social justice, how to make things better in the world. And, what I would say is that there's one level where we do it, working on areas of like systemic racism and working at societal level. But when you come down to the therapy room, what we are doing between each other, we transform at a very different level because we're bringing out the humanity in each other. But the fourth level, that I believe in my model we need to look at is what are the social location narratives? How does their identity shift? And this is related to gender, race, ability, income level, education level. It goes on. Even where you can get marginalized in your family. You're the quote unquote black sheep of the family. You're different from everyone. You can get marginalized at work because you're different. You can get marginalized at school because you're different. So this is where at any level you feel it's your client, we have to do this for ourselves too, where you feel different than others, and how does that affect you? And then when you look at how you move through the entire symptom cycle and how those identities affect every part of this cycle, is absolutely transformative for most people and very liberating and healing for a lot of people. And then also I look at what is society saying about your problem that you're coming to talk to me about? What is society's story about your problem, whether it's depression or autism or divorce or couples, not having a happy marriage, or, family issues or parenting issues. What is your society, the people who are you talk to, who's in your, what is everyone else going to think? What do they say about each of these phases of your cycle? So this really, when you get through this level of conceptualization, which is so simple and easy because we use very simple words here, you don't need a master's or doctoral degree to understand this. So when you move through this and conceptualize in this way, which typically I'm able to do with most folks in a single session, you are crystal clear and your client's crystal clear on where to target and do change. So next, there is evidence-informed treatment planning. And for this, this is huge. And this is something that I really believe is an ethical imperative in the 21st century, that all mental health professionals need to be able to describe the evidence base for what they are doing. They need to describe the evidence base for the prognosis for their client. And they need to be able, in simple terms, you're not citing statistics to your clients typically, sometimes you do, but to really be able to describe the evidence base for what you do and why you do it. So, and this is surprisingly easy, actually. So one of the things I talk about in this course is really about, we literally march through the entire DSM-5 and talk about what does the research say about prognosis and about treatment and treatment planning for all the major disorders. And then also looking at couple and family, because it's not always in the DSM, but research says there, and we have lots of clear guidance. And the truth is there are certain areas where we have lots of freedom, generalized anxiety and depression. There's a fair amount of research that a wide variety of treatments work. Whereas with certain disorders, I like to pick on, OCD or autism, is much more limited in terms of what is going to work and what isn't. And so it's very important to understand this. And the sad thing is, and I really believe, hopefully someone's going to step up to the plate. I'm a professor, I write books. So I'm always, basically my job is to stay up to date on the evidence base, the research base. It's part of what I have to do. And I have full access to, basically every research study ever published through my university. But when most people graduate, they no longer have access to that. Sometimes some of the professional organizations offer that. And so even if every practicing clinician, mental health provider on the planet had access to this information, they're seeing 25 to 30 clients in most cases in most countries around the world today. And they've got mountains of paperwork on top of that. And so they don't have time for this. It's the honest to God truth. And so, you really want, and so this is something that, I do give a very, comprehensive overview, but boy, there are medical doctors and psychiatrists have, databases that do this for them. And we need something in mental health to do that for the practitioner, because they don't have time. Even if they had access, they don't have the time to really stay up to date. And this is a huge gap in the field that really does need to be addressed going forward. And then finally, I want to talk about solidifying gains. This is, what typically happens in the later phases of therapy, because the relapse rate in our profession is really, really high. Like for just major depressive disorder, half the people who are successfully treated are either with medication, some form of counseling, psychotherapy, or both. Half of them relapse and have another major depressive episode in a year. Like, that's horrible. I mean, we pick on, substance abuse is having terrible relapse rates, but mental health has equally for many of our major disorders, for much of what we treat. And so, and I would say that most theories do a very poor job in having really clear methods to solidify gains. And this is so important. And it is really important for any client who's feeling marginalized, not just in terms of gender, race, religion, ability, some of the common ones we think of, but also in their family, in their work environment, in their friendship. If they're feeling marginalized anywhere and they have voices telling them that they are less than, you have to do a lot more systematic work in solidifying those gains. And again, when I do this, I go back to those 4 basic levels of behavior, emotion, cognition, and the societal discourses around it all to solidify at all 4 levels, so that when the client leaves, especially if they have a marginalized identity, they're able to maintain those gains and not relapse in terms of anxiety or depression just because another stressor comes up. So that is the 5th area here, 5th way that synthesis just transforms how you work. Okay, so let's see here. So anyway, I have this course. If you're interested in learning about it, we're closing registration on Monday, 27th. We're getting going. You can register at thetherapythatworksinstitute.com. And here is a coupon code for hanging out with me this today, which is the top 5 tips. You get $250 off the course. So if this sounds interesting to you, I invite you to come check it out. And you can go and read about some of the other folks who've been through the course, what their experience is like. That's on the page if you want to just get a sense. But otherwise, I'm done with my presentation, and I'm happy to take any questions or comments that you have.